So, you know what? It's although some of the symptoms can be very similar, but there are some subtle differences between COVID symptoms and allergies. I mean, allergies typically, the classic presentation of allergy is stuffy nose, runny nose, sneezing, itchy, watery eyes, red eyes. Itchy skin. So these are all usually common allergy symptoms. So when someone comes in, presents to me with these symptoms, at the time when I expect allergies to peak, which basically is around spring and summer, and also now with the fact that a lot of people are having more time to spend at home, so more time in their gardens and backyards, and more time taking walks with the family, they're getting more exposed to all these elements, these allergens that bring about these symptoms. So, the first response is let's try to treat it with available allergy medication. And that's where we come in as pharmacists and educate the public and educate those patients about how to treat that condition. When someone starts telling me, well, I have a fever, I have difficulty breathing, some of these symptoms, they're not usually allergy symptoms. Like fever is not something that happens when you have allergy. Actually, Pharmasave put out a very nice comparison chart that is very helpful. We're finding it helpful for patients. It's at pharmasave.com. And it's right at the center, and it kind of goes along with the news release that was done a couple of weeks back. And it's how to distinguish between allergy and COVID and cold and flu. So, if you look at it, it'll give you a nice comparison of what are the common symptoms with COVID. I mean, now COVID, it's an ever-changing scenario. It's including symptoms such as abdominal discomfort, diarrhea. It's including symptoms that we didn't think were related to that, which is basically red eyes or conjunctivitis, which is an infection of the eye, which also could be an allergy symptom. But when it's allergy, there's a great deal of itching. Whereas with COVID, it's not usually associated with itching. So, there is a way to distinguish between the subtleties, of the different conditions. And I always encourage patients, what, if you have a question, pick up the phone and call me. Pick up the phone and call your local pharmacist. Pick up the phone and schedule a phone consult with your doctor. Obviously, as the first line of defense, if you will, being that we're readily accessible to the public as pharmacists. I mean, we haven't closed one day during the pandemic. We've been open day in and day out, and we're happy to do it. We're happy to educate the public and calm, all the concerns that patients have, rightfully so, of course.